Best Fed Beginnings at UF Health presents Prenatal Breastfeeding Education, Module 5. This presentation is part of a series that will help you feel confident in your decision to breastfeed your new baby. This unit focuses on getting off to a good start. Remember that breast milk is the perfect first food for your baby. Breastfeeding helps you develop a special bond, and it also helps to protect you and your baby from illness. For the next few minutes, you will hear about feeding cues, positioning your baby at the breast, and latching on. The other lessons in this series have focused on getting breastfeeding off to a great start. Remember, start breastfeeding as soon as possible after birth. Ask for help. Remind hospital staff that your baby will be exclusively breastfed. Keep baby with you in the hospital room. Avoid giving pacifiers in those first few days and instead let your baby come to the breast if he wants to suck. There are many different ways you can position your baby for feeding. Let's discuss some of the possibilities. In any position that you use, it is important that you support your baby's head and your breast. You will need to use pillows in the early days to lift baby closer to your breast. This is the cross cradle hold. It is a favorite of new mothers because it gives extra head support and positions baby in a way that makes latching on easy. If you are feeding from the right breast, use your left arm to support baby's back and use your left hand at the base of baby's neck to support her head. You can then use your right hand to hold your right breast for proper positioning. In this position, you can look into baby's eyes. The football hold is a good hold for newborns and for those moms who have had a C-section. Baby lays on his back underneath the breast, with legs and feet under your arm rather than across your lap. You can use a pillow to lift baby closer to you and use the palm of your hand to support baby's neck. The cradle hold is an easy, common hold that is comfortable for most mothers and babies. This hold is good once baby is a few weeks old because baby needs some neck strength to control her own head. In this position, hold your baby with her head on your forearm and whole body facing yours. The side-lying position is useful for mothers who had a C-section or to help any mother get extra rest while the baby breastfeeds. Lie on your side with your baby facing you. Pull your baby close so you are belly to belly. You will need to make sure that the baby's nose is close to your nipple to achieve a good latch. For the biologic nurturing position, start in a comfortable semi-reclined position where every part of your body is supported, especially your shoulders and neck. Then lie your baby on top of your body so that the baby's head is somewhere near the breast. Your baby should lie on her tummy with her body tilted up and she will find your breast. Now that you know some of the feeding positions, let's talk about latching. First of all, try not to get discouraged. Some babies latch right away while others take more time, but most babies that come to the breast within the first hour will latch on well. To help your baby learn to breastfeed, tilt his head up so that his chin is off the chest. This will make it easier for baby to open wide. Next, you will brush your nipple from your baby's nose down to the lips. Your baby should take a big mouthful of breast when he starts to feed. There are many signs you can look for in a good latch. Make sure your baby's lips are turned out, with only the inside of the lips and mouth touching your skin. You may feel a slight stinging as your baby first latches on, but after 10 to 15 seconds, it should feel more like pulling and become more comfortable. Depending on the size of your areola, you should see little or no darkened area when your baby is latched. Baby should begin sucking in a pattern of 3 to 5 sucks, followed by a break for swallowing. Remember, follow your baby's lead. Pay attention to feeding cues and feed whenever and as long as she wants. Remember, breast milk is not only the best milk, breastfeeding also gives comfort to your baby. Listen and watch your baby for feeding cues to know when she is hungry. Your baby will tell you he is hungry. It will take some time to learn these signs, so watch baby closely. Some of the signs of hunger are when your baby puts his hands to his mouth, makes a sucking motion with his lips, or sticks out his tongue. When your baby turns toward the breast and looks like he is searching, this is another sign. Babies don't have to have their eyes open to show you these cues. If it has been 2 or 3 hours since your baby's last good meal, there's a good chance that he is hungry. Speaking of feeding cues, you may be wondering what kind of feeding schedule to expect. Remember, feed whenever your baby is hungry. You can expect this to be about 8 to 12 times a day, or about every 1.5 to 3 hours. You will know if your baby is getting enough milk by counting their wet diapers. You can expect about the same number of wet and dirty diapers as your baby is days old, until day 5 when the numbers increase. In conclusion, plan to breastfeed early and often, and let your baby breastfeed as often and as long as she wants. Ask for help right away if you are unsure of how it is going. Skin-to-skin contact with mom and others helps your baby feel warm, secure, and helps with bonding. We hope that this presentation has increased your understanding of how to get breastfeeding off to a great start. Please let us know if you have any questions about preparing to breastfeed your baby.